As a hospital specialist, I think it is becoming very clear to all of us across the country that as medicine has become much more complex nowadays, we need to find a better way of supporting our primary care physician colleagues. And the trigger specifically for Medefer started a few years ago when I saw a patient in clinic who'd been waiting about 7 or 8 weeks with abnormal liver function tests. It was very clear why the GP felt they needed to send them. It was quite complex test, but from a specialist point of view, we could have just advised and monitored that patient remotely. And it was that trigger that started us looking at saying, how can we create a much more efficient system, both medically for the whole system as a whole, but also financially as well.
Medefer gives GPs rapid access to specialist consultant advice. To ensure a reliable service, as well as a secure platform that's compatible with the NHS e-referral system, Medefer also has its own national faculty of NHS consultants. Services can be set up for cases to be reviewed by Medefer's NHS consultants, a consultant from the local hospital, or a bespoke combination of the two, adapting to local capacity and need. In many cases, the consultant can give the GP a detailed management plan. However, if it is a complex case that can't be managed in the community, Medefer can arrange an onward electronic hospital referral, reducing the workload for the GP.
So from a point of view of GP, if you want to get advice on the Medefer platform, we've tried to make it as easy as possible. So if you're a GP, you don't actually have to do very much different than if you wanted to send a referral to a hospital or any other platform.
As a GP, I really like using the Medefer service. I know all my colleagues do. Very easy system, very easy form to fill in, pulls in a lot of information from our own system, which is great, and then allows us to get a very, very quick response back from a specialist.
The referral that comes in will contain not just the GP's clinical question, but also the patient's past medical history. So from a specialist point of view, it means that we get a much richer data set so that we can start reviewing the patient. It's not just about avoiding referrals, it is certainly about delivering the best care at the best time for that patient possible.
Our teams in the hospital are seeing the patients that they really need to see, and the patients who potentially don't need referral to the hospital are actually being cared for locally by their GP or their primary care team.
Recently I've had a cardiology patient, very, very complicated, number of different things wrong with him, and want to try a new medication with him. So in the past I would have just done a referral, but actually I was able to put all the details in the referral to Medefer, say what I wanted to do and why, and I got a reply back within 2 days telling me what I couldn't do with that gentleman's care. So I was able to manage him much quicker than if he'd waited for an outpatient appointment, and actually he didn't need to traipse up to the hospital to see the consultant. We were able to sort that out for him.
I think there are a number of advantages for patients. Firstly, their care is predominantly provided by someone that they know and trust, their GP, near to their home. That can be done with reference to the specialist within the hospital who can provide advice and guidance on their care without the patients having to go through the scenario of being referred to the hospital, perhaps spending a period of weeks on a waiting list for outpatients.
So a service like this within the NHS being spread across the NHS, I think will have significant benefits across the country. Not only there is a huge amount of time being saved for patients who normally would have waited to have a specialist input in their care, but also this system collects a lot more data. So across the country we can start looking at local services and how we can restructure and make them much more efficient.
This type of platform that we have been working with is very much part of the future. I think it allows us to get our clinicians who are somewhat within silos within primary care and the acute trust actually talking to each other and working more closely, and actually it allows us to identify areas of education where clearly there's a misunderstanding on either side as to the services and capability